to all of our donors out there and everyone interested in the health here of the Valley in Arizona, thank you for joining us. And these videos are really important right now, especially during this COVID pandemic, as a way for us to connect with some of the leaders involved and the institutions that have come together to make a difference here in the Valley. We're also using these as a way to tell impact stories of some of our patients and the important people to us. So we really appreciate everyone joining us. And we have a special guest today, Dr. Randy Richardson, the regional dean of the Creighton University School of Medicine here in Phoenix. Tremendous honor to be with you today. Thank you for joining us.
Happy to be here and happy to do whatever I can to support Valleywise. They have been wonderful partners, as we talked about a few minutes ago.
Awesome.
So we wanted to start this segment just to get to know you a little bit. We know that you're a pediatric radiologist, a faculty member, dean, and researcher and author. I don't know if I can add anything else to that, but when you started out, Spanish literature, tell me how you went from Spanish literature into medicine and then the wonderful role you play now.
Yeah, that's probably not an obvious connection, is it? You know, I think I'm actually a local product. I grew up here in Mesa, went to Westwood High School in West Mesa, and loved it there. And so went away for training and eventually came back. But you know, my dad was a Spanish teacher growing up. He taught for 32 years at Westwood, and I actually served a mission in Mexico, so I speak Spanish too. And I came back and loved the Spanish major, loved literature, but also I love science. I remember in high school I took a psychology class and just loved the idea of being able to help others, you know, and being some part of a healthcare team that helped others. And so that was sort of the connection. But you know, it's not an obvious one, but I majored in Spanish, but I also did all the prerequisites for medical school, and eventually went to Loma Linda Medical School and got my training there, and loved pediatrics and radiology. So I was sort of torn between what specialty to go into, and I found the perfect marriage of pediatric radiology. So that's how I ended up with those two specialties. I love radiology, love imaging, love the way you can try and solve puzzles of what's wrong with the patient, answer questions using imaging to try and improve healthcare. But I really love the focus on pediatrics. I always had an affinity for infants, neonates, and trying all of the congenital anomalies that would occur in them. And I've enjoyed this field for years. I would tell my wife sometimes that I'd pay them to do what I do every day because I enjoy it so much. That's a fun place to be where you love what you do.
Yeah. But Nate, before you go to, you know, your question, just add one more thing, Dr. Richardson. You've been married for a few years. Are your kids here in the Valley and grandkids too?
Yes, we have 6 children. We adopted our youngest 12 years ago, and they all live here in Mesa. Actually, we have one daughter who's serving a mission up in Washington, but the rest of them live in Mesa, and we like keeping them close. And we have 3 grandchildren, and that takes up a lot of our free time. We enjoy that.
Oh, it's wonderful.
Yeah, that's an amazing story, and you know, segues kind of nicely your rich experience or diverse experience, and then having grown up here in Arizona. What do you think? I mean, the next 3 to 5 years, what are your plans? What's important to you from you know, the perspective of your leadership at the Creighton University?
Well, that's probably the most exciting thing that's going on right now is in the short term, you know, we get to open a medical school here in a year, which is occupying a lot of our time to get the curriculum in place, get our faculty in place, leadership in place, and start recruiting the first class that we'll have. You know, our first class that'll go through 4 years here at Creighton University Medical School Phoenix campus.
Yeah.
So we're putting a lot of effort into just that, getting the right personnel in place, the right curriculum we're matching. We have to be comparable to the curriculum they run in Omaha because we're still a regional campus.
Yeah.
There's a lot to that, and so we're fortunate to have two great, I think, medical centers and huge, medical systems really to draw from for these personnel and faculty that we'll need to run this school.
And when you kind of look out, say, and geez Louise, with everything that's going on right now in our country, it might be hard to look up and out this far. But say 5 years out from now, what's some of the big impact that you and Creighton is looking to make here in the Valley?
They did an article in the Arizona Republic probably 6 or 7 months ago, and they said Creighton University School of Medicine changing the face of healthcare. And I had to pause for a second. I said, wait a minute, how exactly are we doing that? And so we have thought about that. How are we going to change healthcare in the area? Lots of people focus on interprofessional education. Lots of people focus on excellence in teaching and patient care and medicine. What are we going to do that's different? And I think the thing that I keep going back to that we do that's different is our mission. And I think Valleywise has that same mission to care for the marginalized in our society, care for those who are most in need, and help them access a very complicated healthcare system. If we can accomplish that, that'd be huge. So 5 years from now, people can say, they did that. Wow. I think it's more like a 10-year project personally, but in 5 years, if we could be starting that process of helping those most in need to access healthcare and get quality healthcare, I think that would be something I would be very proud of.
Well, and it's amazing too to hear that, because I think everyone knows the experience that you have when you have a doctor that cares, when they have that mission-based heart versus one that doesn't, and how much different that feels. You spoke of pediatrics as a parent when you bring in your kid, and that you have a doctor or a nurse that's really there to care for you. It's a totally different experience, and one I think I don't know if there's any science behind this, but I sure think that one that contributes to health considerably.
No question. And really someone who knows you, right? Not just that you go in and see once every 3 or 4 years, but that really knows you. And that's one of the things we want to really emphasize in our school is this integrated sort of program where our students start off seeing patients and seeing them in their environment. It's sort of an area of emphasis for us that we want to be with the community. We want to work with our community to help them to get the care they need, because I think that's the best way to do it.
Right.
And we feel strongly about that, and that's something we're going to emphasize in our school, and hopefully in our residencies and in everything we represent. Is we want to partner with communities, because I think as we do that, that provides the best health care for our patients and for those people in need.
That's right.
So I know a lot of people read about the opening. Just line up for us kind of the timing. So the building, I heard it's topping out now. Is that where you're at?
Yeah. They're all the floors are completed, and so now they're going to start the interior work. They expect to be done by December, January, maybe even a move-in date of March, April. So it's exciting, and it's moving forward. It's on time and under budget. We're pretty proud of that. That's doesn't happen all the time. But even during this pandemic, they've been able to keep on schedule and moving forward. We're also on schedule with hiring the people we need and getting the partnerships in place that will help us, I think, be successful. We partnered with ASU, faculty, research, that thing. We've created an alliance between Valleywise and Dignity that I think is crucial. That was the first piece, because that was the most important piece to having the clinical information and clinical spots needed to support a school of medicine. So we do feel good about where we are in the timeline for this. We'll open our doors for our first class in August of 2021. And we'll open it to 120 students. That'll be the size of our first year class.
It's amazing, and it's amazing that you're right downtown. I think that's great for the Valley as well.
Yeah, Midtown needed that little facelift. I think it's been great for the area.
Yeah.
So last question in this segment is, you know, you can't turn on the news without us talking about the pandemic. We can't walk into our offices every day without thinking about what our numbers are and, you know, how many respirators we have and so forth. And so what do you think from a teaching perspective that we've learned from the pandemic? Social determinants of health, what do we have to be better prepared for next time, or for, you know, other situations that would, you know, allow us to reach people better?
Well, that's a great question. And I think from an educational point of view, this is invaluable for our students. I think, you know, we had initially, when we brought our students back into clerkships and brought them back into the hospitals and the clinical settings, we had several students say, hey, I'm not okay with this. You know, what if I infect my patient? What if they infect me? You know, I'm nervous about going back. But I think that's always been the case, that you always have to be worried that you could potentially infect your patient, and you always have to be worried that your patient could infect you. So what a wonderful environment to learn and galvanize those principles that will help them to be great future physicians from now on. You know, history has taught us that historically, physicians did infect their patients. You know, they didn't used to even cleanse their scalpels. You know, they were infecting every patient they touched. And over time, we've learned that. And this is a great opportunity for our students to really learn those principles of how to properly don and doff PPE to protect themselves and to protect their patients. So I'm excited about this for our students. And overall, our students are really excited about being back in the patient setting where they can see patients and be part of the team that will help you know, solve this problem.
It's amazing.
Yeah, I think this has been so informative. Thank you so much for your time.
Sure. Happy to do it.